Can't hear you.
I'm muted.
There you go.
I'm muted. All right. Okay, Sakia Lee,
Here, present.
Kim Hollers, Brenda Hughes. Both of you all are muted. There you go. Muted. All right. Okay, Sakia Lee.
Again, I'm here.
So this is our first time doing this as a group. I know
Sorry.
all of us have probably been on Zoom, so please allow us some grace. Don't go hard on me or others or each other.
Correct. You're right. Yes, sorry.
So we'll start this up again. Sakia Lee, she already said she is present.
Present. Yes.
Kim Hollers,
Present.
Brenda Hughes.
Can you hear me now?
Yeah, we can.
Oh, good.
Even from outer space.
All right.
All right.
I did that for you, Kevin.
Thank you, ma'am. Patrice Griffin,
Here.
Bobby Helpwell,
Present.
Ben Dameron,
Here.
Carol McGlynn,
Here.
Tim Reddy. He is connecting.
Dr. Reddy, you're on mute, so. There you go.
All right. He's present. Shalana Lewis,
Present.
and Alyssa Stewart.
Present.
Did you ask for Dr. Cooney?
I think I did. Don Cooney, unmute.
I'm here.
All right. I think that's everybody.
Thank you. So everyone, just a couple tips for Zoom. If you hear someone speaking, before you dive in to speak, give it about a second or two so that, there can be that time to make sure they were able to say everything they needed to say before we all dive in. Also, I'm going to ask, which Kevin, I don't see this feature. I thought we used to have raise your hand feature on Zoom, but maybe we don't have that. So I'm going to do my best to see you all and sort of orchestrate speaking, but I'm going to ask you to just raise your hand and keep it there for a second if you want to dive in and speak. The other key to Zoom is to keep your microphone on mute for now, unless you're speaking, because we won't, if someone walks in the room and the dog barks or you get pulled over by the cops because you're driving and on Zoom, we don't have to hear all that engagement because I don't want to hear that. Or if there's other things happening, we don't want to hear that either. So anyway, glad you're all here. Glad you're all safe. You all look beautiful on Zoom. As you do in person. And so it's just good to see you all. It's been a long, long time. You all should have received the minutes of the last meeting. I think it was our retreat, if I'm not mistaken. And so hopefully you had a chance to look at those. And this is the time where you all take your microphones off of mute, and I'm going to ask for a motion to approve the minutes. And if you would say your name, the motioner, and the supporter, that would help me as well when you make the motion. So is there anyone willing to offer a motion to approve the minutes?
This is Sakia Lee. I offer a motion to approve the minutes.
Moved by Lee,
And Dameron, support.
supported by Dameron. Is there any discussion about the minutes? All right, take your microphones off of mute. All in favor, aye?
Aye.
Aye.
Opposed? Motion carried. Very good. You guys are good. This is all right. Number 4, you should have the approve or the agenda before you. Are there any questions or changes or additions to the agenda? We will take the agenda as approved to move forward, since I'll take that as consensus. That'll avoid a vote. All right. We are number 5, reports of officers, boards, and committees. I see A, and I can't, it says none, so we'll go past that, I guess. Sorry, I got a little blob on my other monitor here. Not what that said. Okay. Number 6, member check-in. Mr. Ford?
So I added this, as Mr. Hopewell said, it's been a long time since we've seen each other. And I just want to do a quick check-in. How is everybody doing professionally, personally, during this crisis? So if we can have that, try to keep it at a minute at least. I'll go first. Professionally, it's been crazy. Trying to think about post-crisis world and what that look like in terms of SPK in our community. Personally, having the kids and the wife, that's a different world entirely. And I'm navigating that reality. So that's where I'm at.
So Brenda, since you're laughing and we can hear you, your microphone's not on mute. How you
No,
doing?
because there's nobody in this house, no dogs to bark, and so it's just me giggling that you have to deal with.
Yeah, but that wasn't the instructions. But go ahead. How you doing?
I'm doing okay. I'm here by myself. Been here for weeks. So my kids, though, are keeping me in groceries and stuff. So I'm thankful for that. So luckily, I got like 10 more kids by working at the library instead of just the one I really had. So, so I'm good. It's good to see you all, though. Really good to see some faces.
Yeah. Okay. Dr. Cooney, how you doing?
Unmute.
You're on mute, Doc.
How about now?
There you go.
Okay. Yeah, it's a struggle. I'm learning how to teach all my classes online, which is a whole new thing. And it's coming better. But I get out every day, do my exercise in the morning, go for a long walk. I'm okay. But like Kevin, looking to see what's going to come out of this and where we're going to end up, because we can't go back to just the way we were.
Yeah. Thank you, Doctor. Kim, how you doing?
Hey, I'm doing good. How's everybody else doing?
We're hanging in.
Good.
Lee?
No,
Go ahead,
I've been
Kim.
working. I'm sorry.
No, go ahead.
Oh, I've been working every day, so it's really kind of the same. Doing a lot of distance learning with adult ed students, continuing with the parent literacy class that we had set up prior to all of this. So we're just doing it virtually. In addition, went back to resource navigation. So I'm doing a lot of unemployment applications, DHHS applications, connecting people to resources. So my days are full.
Wow.
And home life, well, they're at home. I'm here. I'm good.
Awesome. Jennifer? I surprised you. I love it. Uh-oh, we can't hear you. Jennifer, I'm gonna come back to you and we'll check in a second. Ms. Lee?
So professionally, good. Just been very busy in Zoom meetings, but I worked for home for several years, so it just takes me back into that. Personally, the good is I have been working out a whole lot and drinking beet juice and smoothies. I'm so fit right now. But I have had now 7 family members in the Detroit area that have tested positive with 2 fatalities. So that has been hard, being away from family and trying to adjust to how you grieve in the absence of contact. But other than that, I'm really good. So,
Well, we're thinking of you.
Yeah.
Ms. Bonner?
Greetings all. Professionally, I am fine, working like everybody else, really harder than I did in the office. I think we don't get to take breaks and get up and walk around, so we just work. Personally, I'm with Sakia. I have experienced more deaths than I would like, than I can count at this point. Actually, I stopped counting. So I'm just grateful to be alive and healthy.
Well, we're glad you are healthy. So, Jennifer, how you doing on that microphone? We're still not hearing you. Okay. Well, give us a thumbs up if you're good. All right. Good. Damaro.
I'm good. Professionally, we've been quite busy. Yeah, it's been crazy. We have amazing staff that are working with individuals on a daily basis still, primarily around unemployment and trying to provide some assistance and how they apply. Obviously, that's not within our realm, but we're doing the best that we can to provide guidance and tips to individuals who are applying. And then on the employer side, we still have employers that are hiring. So we've got Borges that has over 100 positions, graphic packaging, Sam's, Myers. So just trying to provide supports to those employers. And there's just been some really cool success stories that we've heard throughout the process of helping both individuals and employers. So I couldn't be more proud of my staff. Personal side, I'm good. Everyone's healthy. Sorry to hear from individuals who do have family members who have been impacted from this.
Thanks, Ben. Dr. Reddy?
Unmute. Okay, doing fine. Mastering the art of picking up groceries and the drive-in lane. Like Don, also mastering, trying to master remote teaching. I'm not teaching this summer, so I've got the opportunity to do some little more research on my own time. And also we've had 4 extended family members who've had the virus. Fortunately, they all recovered, but I just learned that one high school friend passed away from the virus. It's out there.
Yeah. Thanks, Doc. Sarah?
Hi. Hi. We're doing well overall. Professionally, all of my contracts except the one with the city and United Way have been postponed. So kind of a lull for me. But the positive is I'm spending a lot of time with my kids and we're getting into a groove. And it's fun watching them become even better friends. I have a 1-year-old and a 4-year-old.
Awesome. Ms. Lewis?
Unmute. Hi, yes. Yeah, I echo what folks said just about, adjusting to working remotely and get everything done remotely is challenging in its own ways, but I'm extremely grateful. I feel very blessed to be able to do so and not have to leave the house to work right now. Obviously, having a lot of folks I know have been very impacted in terms of their family with the virus and just struggling in a lot of different ways, I think, with the anxiety, uncertainty of the future, and just the stress that is compiled. So just trying to hold space for everybody as much as possible. Luckily, none of my immediate family members have. I have a few folks that we think got sick, but maybe symptoms didn't rise to the level to get tested. So which is a good thing because they're still with us. But just knowing a lot of people have, that I'm close with have been impacted in larger ways and trying to figure out how to be supportive. So, but overall, I feel very, very, very blessed. So.
Awesome. Ms. Stewart?
Hi, everyone. Excuse me. I am Doing well. Professionally, very busy at United Way. We have our disaster relief fund, our small business loan fund in partnership with the city. So we have been, putting in long hours, like Dorla said. I feel like working more than ever, as is many of our team. Even when it's from the comfort of the playroom, as you can see where I am situated right now. That is not my rocking horse. That's how it's going personally at home with kids. Having to get creative. We're getting help from parents, which is not ideal, but we had to break the bubble to kind of survive with our kids and our work situation. So, like many in that situation, just kind of trying to figure it out. Overall, very lucky. Everyone is healthy and safe, and we're doing okay.
Awesome. Vice Mayor?
Hey, excuse me. Hey, everybody. Happy to see you all. Your lovely faces. I probably can echo what everyone else has echoed professionally. Excuse me, just trying to find a balance. Fortunately, I'm able to continue to maneuver with Zoom. I'm probably this close to being zoomed out, but hey, we're getting through it. Personally, I can't complain. Able to shelter in place. Very dear friend of mine was recently tested positive, so for COVID. So that was a little harsh. And then, just still trying to balance out with everyday life throughout what we're going through. And of course, my daughter is a senior, class of 2020. So balancing all of that out. She's working right now, pulling a 12-hour shift at an adult living facility. So that's very real. I'm still very concerned, but both of my kids who are still in school are taking it as well as I think they can. Just getting through it like everyone else.
Great. Vice Chair McGlynn?
Hi, everybody. Yeah, so personally, we've kind of gotten into a groove working out of the house. Dan's upstairs, I'm downstairs. And we find our space pretty well. We had some really sad news. We lost actually one of our board members at SLD Reed from COVID. So that's been very difficult. My son is an ER resident, so he is between Bronson and Borges. So he's kind of in the thick of things. Although, he's saying that things are running, pretty well. But that is concerning and hard to not see my 11-month-old granddaughter. We get to kind of see each other from a distance, and so kind of keeping up with all her milestones and stuff. But it's going kind of as I think how a lot of people are handling it. Professionally, very proud of where Kalamazoo Public Schools has been at. It's been rough, but they're doing Monday, Wednesday, Friday meal packs and homework packs. They have the continuity learning plan in place now, getting out Chromebooks, but there's lots and lots of challenges with all of this and trying to meet the needs of everyone. And so they're just working really, really hard. Communities and schools has been really active. KidNet has been doing a lot. At SLD Reed, we've converted to online tutoring. It isn't really what we want to do, but it's what we can do now. So I have to say I'm very proud of our tutors. About 75% have gone online, and we're really getting our numbers up. So challenging times, but everybody's stepping up to the plate.
Awesome. For me, I work remote 3 days a week, so I'm sort of in my element. Professionally, I'm excited that we were on the second round, able to get the Paycheck Protection Program for my team. My team has been working because we support EMS, and so we aren't essential, but we are that supportive layer of that. We do billing for EMS agencies, and right now everyone knows how busy healthcare has been, but what you don't know is that EMS volume overall around the country has dropped about 34% because everybody's at home. So no car accidents, people aren't out falling and whatever, no sporting event, no sporting injuries, all this stuff. So my fear is that will affect my organization in the couple months to come. So we needed that sort of gap or that support of PPP. And then I'm happy because the sun has been shining, so I've been able to be on my bike. So I've been getting out and trying to become a little bit smaller. I need to call Lee and get some tips on what she's eating and drinking. So we're going to have a Zoom after this. So, yeah, so I'm hanging on. It's kind of weird. I live alone, so I'm like, wow, I didn't know this house had so many noises and things. So at nighttime, I'm a little freaky, but it's all good. I see Deputy City Manager Lamb joined us. We're just filling everybody in on how we're doing. A quick check-in.
Hello, everybody. So good to see you all. Sorry for joining a little bit late. Zoomed out. Yes. Zoom to Zoom to Zoom to Zoom. Personally doing well. Got my 2 boys at home. I want to echo Carol's sentiments about KPS. I'm so grateful for all the teachers and all the administrators and all the staff that are helping support the education of our boys. So we're doing good on the home front. Trying to get out, like Bobby said, enjoy the sunshine, run when I can. Professionally, I've been just in awe of our city staff and our team coming together and rising to every challenge that we seem to face on a daily basis. And just have lots of gratitude for everyone I'm interacting with. So it's great to see you all.
Excellent. Well, we'll move on to 6B. Mr. Ford, City of Kalamazoo COVID update.
Yeah, so this is in relation to boards and commissions related to city work. We just received an email recently from Jeff Chamberlain, one of our, I believe, deputy city managers as well. But essentially the city is going by what's being handed down from the governor. So non-essential workers for city are required to stay at home until May 15. We're working on what's that going to look like after May 15, and have talked about perhaps some folks going in, some folks staying home. But essentially in terms of boards and commissions, we've been instructed if it's not necessary to meet, to not meet, and staying in line with the executive order. So, like I said in the beginning, one of the big reasons of having this meeting, we didn't meet last month. I thought it was important that we see each other, maintain that connectivity. But moving forward, we'll just follow the guidelines set by the state and what we're doing internally at the city. So it may be a situation where we don't meet next month, to be determined, but just wanted to give everybody an update on that.
Any questions for Mr. Ford?
No.
6C term limits, Mr. Ford.
Oh, I sent everybody email with this information. As you all know, bylaws were approved earlier this year by City Commission. Part of that, we have to establish term limits for organizing committee members. So it's a couple ways we can do this. We could do it now. Some folks will have to choose to serve 1 year, 2 year, 3 year terms, or we could do it randomly. Staff could go back after this meeting, do it randomly, and then send out an email letting everybody know what's happening with that.
Okay, so what's your thoughts? I have a few thoughts, but my thought is that it would be I think it's difficult for us to try to do this as 13, 14 people here on this without some foundational something handed to us that says, you know, here's the rationale for 1, 2, and 3. So I almost think maybe the staff goes back, maybe working with myself and the vice chair to sort of bring back something to recommend, if that's okay with you all. So that's just my quick thoughts. So.
Okay. So I've been working with City Clerk Scott Borling on this, and the 1, 2, and 3 year terms are in alignment with best practices. I can reach out to yourself and Miss Glenn, and we can coordinate if everybody's filling up to that, and we can get something out to folks within the week.
Good.
The only,
oh, go ahead, Miss
I
Lee.
think that's good. I just wonder, because I tend to forget anyways between boards and committees that I'm on. Did we define when our terms like start and end? Like, let's just say I'm up for 2 more years. Well, basically just whatever you pick for me, I just need to know when it starts and ends. That's it.
Right. Okay.
Yeah, we'll bring all that back with some type of explanation. And again, it's not my intent to try to control this. I just think with the nature of what we got going on here, I don't know how easy it will be for not to have some type of recommendation rather than all of us trying to dive in, and at least we'll have something to respond to, if that's okay. So if you shake your heads, that will give me a sense that you are thinking that. Good. I think I saw a bunch of shakes. So I think, all right. Mr. Ford.
Can I ask a question? Sorry
Yes,
about
please.
that. Are you looking for us to respond individually first?
I think that, I mean, what we will do, we'll send it out prior to the next meeting.
Okay.
And put comments in, of course, you know, nothing will be settled until you guys settle it. So everyone will have an opportunity to input or give their thinking or what have you before.
Okay.
Yeah, this is a little unusual because we've been a group, so it's a little backwards than what we'd like. But having staggered terms is important, so we're not all leaving the committee at the same time. So. All right, 6D, 2Gen update. Sarah.
Oh, I'm sorry.
Oh.
In the agenda, I meant to put my name in that as well. But to provide just a
Sarah's face, Sarah's thinking, thank goodness. What happened with that? Gotcha.
Oh, don't worry, she'll have enough time. As a refresher, just an overview of the approach and principles associated with the 2Gen approach. So it's a philosophy, a set of principles and practices designed to intentionally and simultaneously focus on the children and the adults in their lives to ensure that the whole family is able to build well-being, right? And so focusing on family well-being, children and adults, and understanding that it's a set of principles, practices, and philosophies. And with that, the 5 main principles is to measure and account for outcomes for both children and parents or adult caregivers, engage and listen to the voices of families, ensure equity, foster innovation and evidence together, and align and link systems and funding streams. And so if, you know, early when we were meeting as a core team, we got introduced to the work from Aspen Institute, subsequently created All Things Possible. And for those who were in the room at that time, if you remember, we tried to have a 2Gen component. We had a parent coach, Ms. Jada Grimes, who worked out at Interfaith and worked with the parents of the All Things Possible participants, right? So even back then, this was, I want to say 2016, we kind of were veering towards that path. And then subsequently, last year, we went down to Austin, Texas, and got a lot of information on how they created and they're running their 2-gen approach. And coming back from Austin, ran into Sarah Kessler, who was one of the consultants who helped United Way of Austin get their 2-gen work up and running. And so the city partnered with United Way to have her essentially do the same thing here. And I like to allow her space to comment on some of the things that she's doing around that work and offer up time for questions before we get into the other items on the agenda. So, Ms. Kessler.
Thank you for having me. I'm really excited to be here. I still am amazed at my good luck that the work that I did in Austin relates so well to the work I can do here with you in Kalamazoo. My family moved to Kalamazoo about 9 months ago. And let's see, getting a little feedback there. So I have been working on 2-gen in different forms for the past probably 4 years in research and graduate school in my thesis, and then as a consultant for United Way for Greater Austin. And so right now I'm going to quickly talk about the history of the 2-gen work in Austin real briefly, because there was some interest in that at the last meeting, and describe the purpose of our strategic plan. And then I'm going to talk about the data collection that I'm currently working on in Kalamazoo.
Sarah, before you keep going, I'm going to ask everyone to mute your microphones, please, whether you're alone or not. That would help with any feedback, please. Thank you.
Appreciate it. So Kevin defined 2-gen exactly right. And so I'm not going to repeat what he said. But in Austin, we also used the SN network definition for 2-gen. And so before I even got involved in 2-gen in Austin, before probably I even moved there, leaders in workforce development and early childhood started to talk to each other about how they could improve intergenerational poverty, and they built some consensus around using a 2-gen framework. And so Austin as a city, it has some big differences, but also a lot of similarities to Kalamazoo, high levels of inequality, often falling along racial lines, large needs for employees, especially in the tech and medical fields, but lack of qualified workers in town. And then also an ongoing initiative in Austin to address the disparity in school readiness, call it Success by 6. So that was something that was ongoing, and a lot of those leaders were a part of the early 2-gen talk. So they created in 2015 a 2-gen vision for Austin that allowed them to create a governing body and then a stakeholder network. And that ended up being like 100 people. And those are the people who work together to give input and create our strategic plan. Between the creation of the 2-gen vision and the strategic plan, we did a lot of data collection, research projects that included community needs assessments, research into 2-gen best practices, and then that really set us up for a successful strategic planning year. So this was funded, and there was a full-time staff person at United Way who organized the strategic plan planning process, and then a few of us that were hired as consultants. And we also aligned the 2-gen plan with the Master Community Workforce Plan in Austin, which was, it was set up by the Workforce Commission and the city and a bunch of partners to help 10,000 these are their words, economically disadvantaged individuals secure middle skill jobs by 2021. So basically, it was the workforce plan that was trying to get people the skills they needed to fill the vacant jobs. And we also aligned with the school readiness action plan to build on the initiative already created by the citywide strategic plans. 2Gen kind of brought them all together because, believe it or not, the master community workforce plan never used the word parent or child or childcare or anything like that. So by being the bridge between those plans, we hoped to help the city support parents and be able to fill all of these vacant jobs. So I know that's a lot of background, but I wanted to put that out there so you'd have some context as to how Austin is similar to Kalamazoo. And when we created the strategic plan, we set it up as a set of strategies and metrics for us to form an ecosystem of programs that would serve whole families with the goal of improving or eliminating improving intergenerational economic opportunity. So our two primary goals were to increase the number of families served in 2Gen programs, and then improve family outcomes by strengthening existing 2Gen programs and services. And all of our strategies fell into the categories that Kevin described at the beginning, the qualities of a 2Gen approach. One thing that I know was discussed when representatives from Kalamazoo went to Austin was to not reinvent the wheel. And one of the places that I think that is most applicable is the definition of a 2Gen approach. So in Austin, we had a data committee, and we created a definition of a 2Gen approach based on the Ascend model that allowed us to categorize every program in Austin that served families in some way. And so that is what I'm working on here. So the definition of a 2Gen approach, I know this is like a lot of words to just be listening to without a visual, so I can also send this out afterwards. But the definition of a 2Gen approach that we used for data collection and categorization was that services are delivered deliberately and simultaneously for both generations. Outcomes are measured for both generations. Services for children include interventions that promote child development, and services for parents or caregivers include adult education or job training, leading to the potential of employment with a family sustaining wage. So then what I'm working on here is taking that definition and applying it and looking at all of the programs in Kalamazoo to get an idea of the landscape of who's doing what, who is 2Gen, who is close to 2Gen along a spectrum, who is doing a component of the work. And I am starting with the funded partners with the City of Kalamazoo and United Way, and then we'll move more broadly around who we decide to include. And later, if we need more information than what we have, we can do a survey, and that will allow us to then put every program into a category of 2Gen, near 2Gen, or not 2Gen. And then hopefully I'd really like to map it geographically. Then we can look and see where the opportunities for expansion of services or partnerships, co-location, that kind of thing. That being said, one thing we'll have to add to all of this is how we can utilize remote work that people are doing, because maybe we don't always have to be in the same location. And then the last thing that I'm working on for the city is creating a document with the definitions that we've talked about and some shared messaging to help us talk about how and why we are integrating a 2-gen approach into our work. So I am here to do a small piece of what I did in Austin, and then it'll be exciting to see how it grows. And I really, I'm open to hear your questions.
Okay. Thank you, Sarah. Mr. Ford, anything else to add before we get into questions?
No.
Okay. So I'm going to have you raise your hand, and I'll try to see and call on you that way so that I'm not trying to navigate 14 voices. Dr. Reddy, I see you are ready.
Yes, Sarah, I was just wondering, the 2-gen work that you did in Austin, can you briefly describe one or two of what you think were the most innovative or successful projects that you did, and how you know they were successful?
Yeah, so we're not super far into the strategic plan period. It was a 5-year plan, and I was really mostly involved in creation and early implementation. So I can tell you what I think was most innovative, but in terms of metrics, I don't think that much has been implemented for long enough to know. One thing that we were able to do was create a funding mechanism that seems to me to be similar to what this city and United Way are doing here, but we specifically had some funding for partnerships or programs that were close to implementing a 2-gen approach who needed funds to just do that one last piece. And then we were also able to provide technical assistance to help with that. So for example, 2 programs that had come together to provide services. One had expertise in adult ed, and one had expertise in high quality early childhood, but they needed funding for childhood after hours. And so able to fund that last piece, support them in collecting the data they needed to collect, and they were up and running 2-gen program. So I think the ability to quickly and pretty easily fund these turnkey needs to allow the programs to be 2-gen, I think that was really helpful, because often it comes down to money. And then the other thing I'd like to highlight is the presence of those partnerships. By creating a really large stakeholder network and having meetings, and then we built in opportunities for people to talk to each other and network. We had really interesting partnerships come out of it that people who had never met, because one was in the adult world and one was in the child world, and they didn't know what other people were doing, and didn't know they were neighbors, or didn't know they had complementary programs. Partnering together then as a result of those meetings, potentially getting funding from us and technical assistance from us, and then really building on the benefits that the research shows from co-location. So having parents and kids show up to get served in their programs at the exact same time and place, improving the intentionality of all of the 2-gen approaches. So those are my 2 favorite things that I think were the most impactful. And I can see the beginnings of both of those already happening in Kalamazoo.
Thank you.
Looking for other hands. Brenda?
I wonder, was there any education for the nonprofit community in educating them to think in 2-gen thought process instead of the way some of them may have been thinking, which might not have been?
Yes, I'd say there was education, but I would also say a lot of it was informal. It was inviting people to the table that we thought really had something to contribute. And then by us talking about it with a 2Gen framework and then hearing what other people were doing, organically people started to think more whole family supporting. So I think sometimes we would do a more formal education, but often you can't, nor should you, just tell people how to think about something differently.
No,
Right.
no, I'm not
I'm
suggesting
just
you
saying
tell
you
them.
were really
Yeah.
well. Yeah, no, I know you're not. We
I
just
was
were really
thinking,
careful.
I was thinking about our first round process even at SPK and how some of those programs might have been much better if
Yeah.
people had been thinking that way. Thank you.
Totally. And I thank you for asking that question, because you're right. It's not the default way that we think about it historically. And I think a lot of what the progress we were able to see was because it was a really organic, people coming and talking about what works, what didn't work, how they were moving along the 2Gen spectrum, and then that supported others at other nonprofits who saw elements of their programs that then could be improved like their peers. But we also worked on shared messaging, which I think helps people think along the 2Gen framework, because then you have people using the same words and understanding what other people mean. And that's something I'm hoping that I can help with here too.
Thank you.
Thank you, sir. Allison?
Hi,
I mean,
everyone.
Lisa. I didn't mean Alice. I mean Lisa. Sorry.
No worries. Always. So real quick, not even really a question, more a point of excitement. I think something you mentioned, Sarah, just got my wheels turning. I just think I want to reinforce what you said about, I think coronavirus has created a whole new opportunity, urgency to this, in the sense that I think when we went to Austin or when we talked about this, we did think about things like physical co-location.
Yeah.
And I just want to lift up that, like, the way that so many nonprofits are shifting service delivery to online methods kind of creates a whole new layer of opportunity here that could be really beneficial and economical, and just really create a lot of new and different opportunities. So just excitement for the timing of this and the potential.
Ms. Lewis?
Thanks. I have a couple questions. It is exciting. When I first kind of was hearing you talk, immediately my mind went to, I think there's a lot of grassroots types of leaders and programs in our community that I would think of as 2Gen, but I don't know if they would, well, probably definitely not use the language of 2Gen, but also may not fit the definition neatly because of, specifically because of one of the parameters you used to define it was around evaluation metrics and measuring. And I don't think that's a strong suit of some of the like more grassroots programs. However, I think there are some that are definitely doing 2Gen work. And so I just wanted to lift that up, that part of the way we're defining 2Gen work is around evaluation. If there's some thought to be put behind in this early phase, how can we support folks to get to the place where they could evaluate along those lines to meet the definition, and so that we're not leaving folks out that are doing the core of what we want to see happen. So I wonder about that. The other question that I had was around.
Can I address what you're saying first before you move on?
Yeah.
I have two thoughts on that. One, I absolutely think we can build in strategies for how we can support grassroots organizations to improve evaluation. If that's something that people are interested in, we can absolutely grow that capacity. However, I do think the spirit of the 2Gen definition, including that point, is also to get at the intentionality of working with both generations. And you can measure if an agency is working with both generations by looking to see if they track both generations. Because because it's very easy for a nonprofit to say, oh, sure, yeah, we're primarily kids, but we work with parents, and you find out later that it's definitely an afterthought or it's something very small. And I think the spirit of that point is that intentionality in the data collection itself is almost secondary. Does that make sense? Yeah, that's just my opinion. We can absolutely build capacity for evaluation, but I think the intentionality is the important.
Yeah, thank you. Yeah, and it may not even be capacity early, building early on, but just understanding that when we're working with, if we're evaluating who in that's operating on a grassroots level would fit, to be more flexible about the parameters around evaluation, I think is also helpful. So thank you for that. And then the other question I have is, I wonder in Austin, was there any like really interesting projects around parent and parent leadership?
Yeah.
Or, parent, empowerment type of a thing?
Absolutely. The parent-related work was mostly done in the section on social capital. So we looked at inter-family social capital, professional social capital, but then most interestingly to me, that parent social capital, where seeing where families were already coming together to support each other, to share resources, and how we could support where they already were, and then where we could also create new spaces for parents in ways that were meaningful and for parents to work together and share resources and support. Part of that was creating a parent advisory council at United Way. And they worked with more than just 2Gen. They also worked with our early childhood work and some policy work. But having parent voices and a dedicated staff person to really make sure that the parents' voices were being heard and represented in all of our programs, including 2Gen. That being said, I think it wasn't necessarily our strong suit. We should have had more parental involvement. And I think that that's something that I've already seen in Kalamazoo, that parents are included in the language to different committee meetings or things like that. So I think that there's a lot of opportunity there to have parents in a leadership role.
Awesome, thanks.
I'm not seeing any other hands.
Please feel free to reach out to me directly. My email's in the group emails we've been getting. I'd love to talk more about ideas or opinions you have, especially opportunities for how we can create partnerships during this time of increased technology usage and no co-location.
Dr. Cooney?
I just want to say I think this is tremendously exciting and exactly the direction we need to go. So thank you so much. This is great.
Thank you. I'm really excited. It's a weird time to be new in town and at home, and I'm really pleased to have the opportunity to talk to you guys about this work that I'm so passionate about and excited to do in Kalamazoo. So please don't hesitate to reach out to talk more about it with me if you can.
All right. Thank you. Mr. Ford, anything else to add?
No, that was it. I've been emailing IT, so they were on this meeting as well, in case we got any calls or comments from the public, and they indicated that nothing came in. So yeah, that's all I have on that.
Okay. Well, I wanted to do a couple miscellaneous items. Wanted to remind everyone we do have an election tomorrow. The K-RISA millage is on that ballot. And so if you have not voted by mail, please do that. If you need to vote tomorrow. Please just be safe, wear your mask, remember your social distancing. It would be even good not to talk to anybody if you can avoid it when you're in these closed spaces. Then I wanted to mention that we as SPK are really going to need to be thinking about this summer and our young people with the gaps that we're probably going to be wandering into with young people from the lack of many different things that they didn't get in school. And then you're starting to see summer programming be adjusted and changed. I know that Pretty Lake won't be having camp for kids at the camp this summer. We'll be going into neighborhoods and trying some, bringing Pretty Lake to the neighborhoods and trying to support Parks and Recreation programs and augment the staffing. So bringing about 10 to 12 people into the community and seeing where we can help there. I don't know what's going to happen with Sherman Lake and some of the other programming this summer, Nature Center camp. So I think these summer program or enrichment programs are going to be vital this year. So we really need to think and see if there's any opportunity for us to support or guide or whatever. I don't know. It might be good, Kevin, to get an update on adjustments that All Things Possible and Parks and Rec may be doing with their summer camp programs, just so we know. And yeah, so that we have lots of opportunities for our young people to try to fill those gaps that they're going to have. So my miscellaneous, Ms. Lee.
Just to piggyback off what you were saying with the absence of some programs running, and certainly with kids being out of school, transitioning into out of school time. So Kevin and I sit on the KidNet board, so we are working closely with Meg to get a pulse of if summer programming will start in places, or if like the Boys and Girls Club, they're actually doing some virtual components right now. So we've been talking to them, and the original, well, the only youth what do you call it? The only youth program that the grant that I'm calling it a grant. But the
Eastside Youth Strong?
Yes, Eastside Youth Strong, the proposal, that's the word I'm looking for. The proposal that we approved, that was supposed to start the learning piece this summer, because the first year was to do some research and teaching. So Kevin and I will be meeting with Eastside Youth Strong to see where some adjustments can be made there. And just to really trying to wrap our heads around how do we keep the work moving and know that children still need some engagement, but we're now in this virtual space. So we have began to.
One of the other conversations I've also been having with Kevin is this entrepreneurial space. So we know coming out of this, well, we don't know. There's a lot we don't know coming out of this. And certainly the nature of work may change for a number of us. Some of you talked about that when you did your check-in. But we will likely lose some small businesses and some restaurants here and there. And that's not good. And so don't let my statement from here mean anything other than I'm sad about that. But as we think about these, especially in the restaurant space, these entrepreneurs that are out there, young people, people of color, those students at KVCC and the culinary programs, all of these things that we have where folks haven't had access to getting into owning and what have you, there may end up being restaurant spaces that are available. There may be food trucks that are available. And when you're an entrepreneur, sort of starting that realm of a bricks and mortar where you got to outfit a kitchen and a dining room and all those things, there may be different sort of opportunities for folks to find their path if we're smart at working with individuals that have been left behind that have this sort of acumen towards entrepreneurism, which is job creation. So it may be one of those things that we really need to be thinking about from a city economic development and planning department standpoint as we start to get the nature of the landscape of change that we may see. Structures are going to be empty, what storefronts aren't going to be out there and available. So that's where we go with that. I don't know, but I wanted to make sure we we raise that. And of course, coming out of this, we've got a lot of opportunities, whether it's employment, and whether it's even our summer employment program. What is that going to look like this summer? The YOU has addressed that in a previous meeting I was in, and what they're going to be trying to do. So just wanted to raise that here and now. We know that particularly people of color, and particularly African Americans, are going to be the highest affected by COVID and the unemployment challenges, employment challenges. And we're going to have to find ways to be smarter and supportive and that sort of thing. It's almost as if, and I've said this before, I think we need to be creating a GI Bill of sorts, not necessarily exactly the same, but the GI Bill was one of the most supportive programs, not for everyone, don't get me wrong, but one of the most supportive programs in guiding prosperity for individuals, and a lot of metrics and a lot of systems that were addressed through that. So anyway, Dr. Reddy, I saw your hand.
Yes, Bobby, maybe if Dorla and anyone else could comment briefly on what the impact of the pandemic has been with regard to housing security in the city, and if anyone else might also address food security, and basically just succinctly, how has that impacted those most vulnerable in Kalamazoo?
Would that be Director Lamb or Ms. Bonner? You said you? Okay. No, Director Lamb?
I can certainly do a start, and then we can also follow up with information. Through the Kalamazoo County Resource, or Kalamazoo County Response Consortium, Adam Castle 211, they've been convening weekly calls with anywhere from 100 to 200 individuals representing organizations. The purpose of the call is try to gauge where the need is at, and then they're coupling that information along with calls coming into 211 to try to assign resources from the Community Foundation's Urgent Relief Fund and the United Way's Disaster Relief Fund. As I'm talking, I'm realizing we have Community Foundation and United Way on our board, and so I'd love for them to chime in after I give an overview. With that, you can go, both organizations have fabulous websites that show where the resources are going, and to no surprise, you'll see housing and food, childcare among the top needs that these resources are being deployed rapidly to address. So we're seeing huge hits to food, huge hits to housing. What I've been very encouraged by, due to the funding collaboration and the partnerships that I just described, the mechanisms to understand the need, to look at who can provide these needs, deploy resources and get them out the door. I've been very encouraged by that. But I think what colleagues might echo is, we know the need is great and we know the resources are going to be kind of limiting. So I also would add, on the housing side, certainly folks, I'll call out Mayor Anderson, our shelter providers have been coming together, meeting sometimes 3 or 4 times a week on Zoom calls to understand the need of our most vulnerable population. And I've seen coordination and collaboration like nothing before. And also want to give a shout out to Alyssa Stewart and the United Way taking on the continuum of care. Them stepping into this new role in this moment has really positioned us to be in as good a place as any as we can be to address the great need. So with that, I'd love to see if you got any comments coming in from Community Foundation and United Way on that question.
I want to add something first. I'm going to send out an email after this. The Community Foundation's TRHT did an awesome Truth Talks, I think last week, related to housing. It had a lot of good information. Alyssa Stewart was on that, as well as some others, but a lot of good information, local information about what's going on in the housing area. And so I'll send that link out after this meeting.
Ms. Lewis, any updates for you?
Sure, thanks. Thanks for bringing that up, Kevin. And thanks, Alyssa, for joining that call. We also had our national partner, PRAC, Patrice, Vice Mayor Patrice is on there, and Legal Aid was also there, and actually have several action items that kind of came up through the conversation between the group that I can share with this team. just around more proactive. I think right now, and Alyssa could probably speak more to this. We also had Stephanie Hoffman on there. Alyssa could speak more to the kind of shelter strategy that has really came up, and it seems that folks are really acting really fast and doing a great job trying to figure out solutions for folks who are have instability in housing. However, one of the things that we focused our conversation on was more of a medium and longer term strategy around what will it look like when the moratorium on evictions end. What are some of the proactive things that we can do? And so those are more of the topics of conversation, more than kind of immediate needs. And I really, so a lot of it was advocacy, and I was actually going to ask, I know there was an advocacy subcommittee that we had, ad hoc committee that we had started. I just wonder if it's time to reinvigorate that, just knowing that I don't think the goal teams are meeting right now, or if they are, how can we get behind some of these things? Some of them are local, some of them are on the state level, and some of them are on the national level, just in terms of advocacy for housing. And I think when you're talking about housing families, and I think that aligns really well with our earlier conversation of the true generation strategy, because anytime you're talking about housing a family, you're going to have, that's going to address a lot of the issues. We hear that over and over. So I think there's big concerns just about what's going to happen once the governor lifts the moratorium on evictions. Are we going to have like an onslaught of people getting pushed out? And as a result, are we going to have folks finding this opportunity to increase rents in newly available units? Like, what is going to happen with our housing stock? I think that's a big concern from my end and what I'm thinking about. I'm happy to send out the notes I took on solutions that the panelists talked about. One of them was expanding eviction diversion. Some of it was some policy work, et cetera. And then, you know, I'll definitely turn it over to Alyssa to talk more about what the kind of current, because I'm not up to date on the shelter strategy yet, but.
Yeah, no worries. Thank you. Yeah, so I guess speaking, and Lori did a good job summarizing everything actually. To the original question, I mean, we're seeing huge demand around food, shelter. Hazard pay has come up, which is interesting because it kind of ties back into this whole kind of economic stability issue, which is a lot of the people in the social service sector serving the highest risk populations are being paid $10 to $12 an hour. So our overnight shelter workers, those direct service workers. And so through the Disaster Relief Fund and Community Urgent Relief Fund, we're fielding quite a bit of hazard pay requests because they cannot keep staff and keep fully staffed in this current situation. So just something I thought I'd mention that we hadn't yet. So yeah, we have some shelter stuff set up. We have a hotel site where we have placed 165 people. I say we, but HRI is leading that, working very closely in partnership with Gospel Ministries. So that's allowed Gospel Ministries to get down to just about 56 people last night. At the beginning of this crisis, they had upwards of 250 people there staying every night. So we've been able to deconcentrate that shelter significantly, which is huge because as you can imagine, people in a large room in bunk beds is not the social distancing that we want. I think this has been a wake-up call for me, just in general about the risk, the public health risk that is there anytime we have people in mass congregate shelters. We have too many people in emergency shelter in our community on an ongoing basis. And so it's just something that it's kind of I think invigorated a lot of people's focus on getting these people into permanent supportive housing and out of the system where they're so vulnerable to this health issue. We have an isolation and quarantine site set up in Battle Creek currently. We're looking at expanding that because we are seeing quite a few positive cases amongst the homeless population. And then we've opened up an alternate day shelter with Mayor Anderson's leadership, and ISK is manning that site. So all kinds of different things we're trying to do to deconcentrate and to not create as many people in shared spaces together. So yeah, this has just presented a really unique challenge. Even at the beginning of this, just realizing that all the restaurants the libraries, all of the spaces where homeless people were getting informal shelter were closed. So we put porta potties downtown and sinks and different things. So we really have had to get creative to meet the needs of that population. So that's other things to share. I think on the eviction side, or on the resource side, I would just share, and Laura can speak to this too. With the eviction piece, totally agree. I think we're definitely going to see a huge wave of need around rental assistance and eviction diversion. On the good side, we are going to have some state and federal resources coming into the community from the CARES Act. So with the Emergency Solutions grant dollars, regularly called ESG, we're getting an extra $910,000 into the community that we can use for rental assistance and a lot of these emergency housing efforts that I just mentioned. The hotel intervention, for example, costs like $100,000 every 2 weeks to have those 165 people at a hotel and all the food and things they need and staffing. So resources are coming. I know CD Community Development Block Grants, some additional dollars are coming through that pipeline as well. So just something to share that while it won't meet all of the need, some extra state and federal resources have started coming into the community.
Looking for a hand. Dr. Reddy?
Yes, just a question for Ben. You know, the statewide, I've read that, you know, 1 in 4 workers in the state has applied for unemployment in the last month or so. What does it look like in our county? More than that, less than that, and specifically in the city, if you have an idea?
Yeah, we don't have city statistics, but 1 in 4 is pretty accurate for the county. So if you look at prior to the pandemic, this year from January through mid-March, there was just over 140 individuals that applied for unemployment. Since the pandemic, it's been over 25,000 individuals that have applied. So it's significant. And just in terms of resources, that was a piece that I was going to touch on as well. So at a federal level, last Friday, actually, the House introduced Relaunching America's Workforce Act. So it'd be $15 billion, which when you look at the Recovery Act that came out of the recession, it's about double of what was put into the workforce system during the Recovery Act. There are plans to introduce that in the Senate as well, and there's a lot of support from national associations and workforce-related groups. On the state level, Bobby actually brought up the GI Bill. So last week, the governor introduced a Future for Frontliners program, which is modeled after the GI Bill. And it's going to be college scholarships and tuition reimbursement for essential care workers. So the details of that program are being worked on actually currently in hopes it'll be up and running January of 2021. And then just in terms of general policy, like housing was brought up a couple of times. The Institute website, on our research side, they've been doing some phenomenal work in putting together proposals and recommendations. And across the board, not just workforce related, there's been a couple of housing pieces, education, higher ed. So would definitely suggest this group, if you could go to our site, take a look at them. They're all very quick, easy reads, like less than 800 words, but great recommendations. I feel like, obviously I'm biased, but for local, state, and federal government.
Thank you, Ben. Ben, the $15 billion and that act, what will that do?
So it's a targeted population. So it's Workforce and Investment and Opportunity Act, which YOU administers locally. It's for adult workers, dislocated workers, reemployment services, trying to think what else, AARP, senior services. So it's targeted funding towards individual populations that have been impacted during this time.
Gotcha.
And it's all training related, supportive services, on the job training reimbursements. It's the typical fund sources that we currently use, but it's expanding and bringing us more capacity, which we know we're going to need once things open back up.
Gotcha. Thanks, Ben. One other thing, and go, oh, did somebody have something? I didn't see any hand. One other thing, and maybe this is for Ms. Lewis and Ms. Stewart. You know, I've been seeing a lot of the funds that we've established that, you know, SPK dollars going into one and Foundation for Excellence dollars going into another. But, and this is just from us trying to connect the work that we're out there doing things. There doesn't seem to be a lot of branding that connects these dollars with the city or with SPK. There's some, but every time I hear, when I think about $2 million of FFE dollars going towards the small business stuff and very little connection unless you dive in and look for it back to the Foundation for Excellence or SPK not giving up, but contributing $300,000 or 200 and something thousand dollars. It's just, I would love to see that we continue to have that connection, communication strengthened. Not saying it's not there, but sometimes it seems like we're invisible as a city on this stuff. And someone asked me, again, I'm not the mayor anymore, but I still get the questions, what are you guys doing? Why aren't you doing anything? And I'm like, we are, but people don't connect that back. So I just wanted to give that little tidbit, and maybe that's intentional. I don't know, but I think that we need to make sure that folks know that the city is doing what it can to be a part of the solution to the challenges. Brenda?
Yeah, before we got off of housing, I just wanted to report about my Zoom meeting with HRI that I have every month. Because I was concerned about how the housing millage is going, but it seems to be going fine. So I know it's only 100 families a year, but to those 100 families, it's everything. So the only thing that's suffering, of course, is home visits at this point, but that's being done by telephone or whatever, but people are still getting their applications through and finding places, getting housed. So we're not behind. We're right up where we should be in year 4. So just wanted to report that.
I am not seeing any more hands. This is sort of the miscellaneous part of the agenda we were on. Mr. Ford, I just want to confirm, just so that it's coming out of my mouth, we have no public comments that have come in?
Correct.
Okay. Is there anything else from the community for the good of the order? Going once, going twice. Well, thank you, everybody. We will stand adjourned. Mr. Ford, you'll keep communicating when we're going to connect next.
Yep.
Came out of this meeting today about what's going to happen this summer, what's happening with housing. So there may be some things that we need to regroup on in the coming weeks, everybody. So stay tuned for that. And with that, please be safe, be well, the best to all your families, all you folks that are hanging out with kiddos in your households. God bless you. We now know that teachers, we always have known, but educators have been vital to everything that we have ever done in this nation. And if this doesn't remind us, I don't know what the guy without kids. So anyway, with that, thank you, everybody, and enjoy this wonderful day.
Bye, everybody.
All right. Take care. Thank you all.
Bye.